Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. If you have noticed, spring has sprung and there is pollen everywhere. Allergy season is underway and it might be causing you some sniffles and some things you'd like to address. We're talking with Dr. Ellen Frazier today about allergies and what we can do to kind of tolerate this season a little bit better. Thanks for being here.
Oh, thanks for having me.
Tell us, what are some of the signs and symptoms that, yes, this springtime is really messing with you?
So runny nose, itchy, watery eyes, those are the primary allergy symptoms, and then some people get a cough as well as like a feeling of fullness in their ears.
It sounds like so many of those symptoms could be something else, maybe a cold, maybe COVID. We've been doing that for so long. How can you tell the difference?
So usually with the cold, COVID, flu, the symptoms are worse, and a lot of times they'll be associated with a fever. The cough will be productive of phlegm. So that's your first sign that something else is going on. And then, of course, it's seasonal allergies, so we know it's the season. So suspect allergies first.
It can really make you miserable, though. I mean, it can bring on that headache and the sore throat, and there are so many different medications on the shelf. How can you kind of distinguish which ones might be the best starting place to see if you can get some relief?
Yeah, so definitely the antihistamines, so things like Claritin, Zyrtec, Allegra, those are kind of our first line, and any of the generics are just fine. And then beyond that, you can do nasal sprays like Flonase or Nasacort, and then they do make allergy eye drops as well.
Yeah, that's helpful too, because those itchy eyes can really get you.
Yeah.
With all of those medications, we all know medications can have some kind of side effect. What are things that you should watch for?
So the biggest with the antihistamines are dry mouth, and some of them can make you tired or sleepy. So a lot of times I recommend people take them at night, and just be aware that that can't be a side effect.
Yeah, that's a good suggestion to do that nighttime, just in case, and then you'll wake up kind of fully loaded with medication and help you deal with those symptoms. Yeah, that can be really, really, really helpful. Should you consult with your doctor before you start taking one of these medications, or do you just give it a go?
It's never wrong to consult with your doctor, but they are over the counter, so primarily they're all safe. But if you're on several different medications, it's always a good idea to ask your doctor if it's going to interact, or your pharmacist.
When would you think, I'm sure that, are there prescription allergy medications?
There are, but primarily it's what we write as a prescription is available over the counter.
If the medications you've chosen over the counter aren't working, should you consult your doctor and see what your next method should be to try to relieve your symptoms?
Yeah. Again, never wrong to consult your doctor, but you could try a different medication or a different vehicle like the nasal spray or the eye drops instead.
Are people on these medications forever, or is it intermittent?
Depends on the person. So again, seasonal allergies, some people just need to be on them during their allergy season. So a lot of times, like right now, pollen, springtime, they just need to be on it in the spring. But some people do need to be on them every day forever.
Just as sort of maintenance to keep that at bay. Is it common for people to not have problems in their youth and then maybe develop adult allergies, or can it go either way? It doesn't have to be lifelong?
It doesn't, yeah. Our bodies change all the time, and I have a lot of patients, like you said, vice versa. They had it in their youth and not in their adulthood, or the other way around.
And so just looking for some relief. What are some things that you can do in your home to maybe minimize your exposure to some of these pollens and the allergens that might make you miserable? Yeah,
so definitely being aware of kind of your allergen season, and unfortunately avoiding going outside when the pollen counts are really high. So a lot of times the newspapers, our favorite news channel might report on the pollen levels, so avoiding being outside during those times. And if you are outside, when you come in, take a shower, wash your clothes, get rid of all those pollens before you hop into bed. So.
Right, and maybe not sleep with the windows open this season.
That's another good suggestion, yes.
Yeah, because all that pollen can kind of creep into your bedroom, and then you will wake up feeling just not your best. Well, so many things we can do to try to keep these symptoms at bay and take better care of ourselves. Spring is such a beautiful season. Don't let it make you miserable.
I agree.
All right, Dr. Frazier, thank you so much for all of your tips and advice. We appreciate it.
It was a pleasure.
Yeah, thank you for being here for Valley Health Minutes. We'll see you next Monday.